Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining us today on Simple Health Radio. I'm your host, Dr. Emran. We have a very special returning guest today, Tawanna Jackson. She was on one of our last episodes, and she talked about mental health crises in America, as well as some of the resources that are available. She is the CEO and organizer of recoverywarriors.org. She has a LinkedIn page as well as a Facebook page, so you can search for recoverywarriors.org. Her phone number is 678-558-9330, and we are delighted that she's returning today as a guest to be on our show. Are you there, Tawanna?
I am here, and thank you again for allowing me the opportunity to be on this platform. Just great to be able to just spread awareness, not just here locally in the Atlanta area, but out there in Texas. So thank you again, Doctor. I really appreciate the opportunity.
Absolutely. Thank you. And we had some really great feedback from our last episode. We had a lot of callers and people on social media that wanted to thank us for having you as a guest on, and they found out about some resources that they'd never had even been aware of. And so I'm glad that we were able to promote awareness about some of the anxiety, depression, and the bipolar topics that you discussed in the last episode. So thank you again for being with us today.
You're most welcome, sir.
Very good. Now, today we're going to shift gears a little bit, and we had talked a little bit off air about some of the crises, not just mental health, but other crises that are facing Americans. And you have some experience in what we call infectious disease. So can you tell me a little bit more about some of those aspects of the healthcare and some of the things that you've been involved with infectious disease?
Well, working in the behavioral health field, dealing with that type of population, there are quite a few people that I work with on a day-to-day basis who are infected with either like an HIV type of infection or Hep C. So just working in an environment to where I'm exposed, and when I say exposed, sometimes the situations call for people aren't in the best of health. So working in an environment like that, I'm really a huge advocate of free testing. When people are subjected to those type of infectious diseases and not getting the required medicine or care, it costs us, and I don't like to put dollars first, never over human lives, but it costs more money on the front end if we were to just use preventative measures such as contraceptives, testing and knowing your status. The other week was a National HIV Awareness Day. I think it was last month, it's about a week or so ago, National HIV Testing Day. And I encouraged several peers, and usually I end up going and get tested like every other month because I usually have a peer that'll come in and they're afraid it's their first time, or they might have, engaged in some type of risky behavior, and they want me to go with them. So I'll go and I try to lead by example to show them, hey, it's okay. It doesn't hurt. It's a little prick. They can let you know within 15 to 20 minutes, and you can carry on with your life. So it's really imperative that we know to practice safe sex, go get tested, use those free resources, and actually know what some of the to HIV. I mean, it's not a death sentence. A lot of people think it is, but I work with people who thrive, and they live really great, productive lives, although they live with those infectious diseases.
Absolutely. And I agree with you on a lot of those points. And as an ER physician, it's not the first place that people think of, in terms of HIV, but it's actually a major epidemic in the United States. And our hospital recently, they purchased lab software, which allows them to take a blood test. And within, as you mentioned, 15 minutes, we get a result back. So, for example, if someone was just exposed to HIV or they have some high-risk behavior, those are things like IV drug use, multiple sexual partners, things like that. In 15 minutes, we can take a blood sample and actually have the result back before they leave the ER and diagnose them with HIV. And the hospital also allowed us to connect those people with what's called an infectious disease specialist. So those are doctors who prescribe the medicine for HIV. And some of the feedback we've gotten has been very, very positive because before it took days for us to get the results back for HIV testing. And when we call those people back, they give us a wrong number, or maybe they're homeless, or maybe they have no contact information. And so we had these results that we knew these people have HIV. We had no way to connect with them.
Absolutely. And in situations like that, that's a very good point. In situations like that, if you don't have a way to contact them, or they had to wait 3 or 4 days to get those results, look at the social impact that has on us as a whole, because that person might go engage in other risky behavior, using those needles or having multiple sexual partners. So they're not only are they putting themselves at risk, greater risk, but there's, someone else that's being intertwined in that particular situation. So it's very important resources like where you work in place, so that way, again, on the front end, we can take the necessary precautions and send them on the directed paths that are appropriate for their recovery.
Absolutely. Very good. And then we had also talked a little bit about hepatitis and hepatitis C in particular. Can you tell me some of your experiences with that type of illness and how it relates to different populations, especially with the mental health community?
And this isn't any numbers to this. Don't anybody, say that I quoted someone wrong. This is me seeing what I see from a behavioral health professional on a day-to-day basis. What I've seen with Hep C, and I've even experienced it in my family, is that it's a lot of black males. Older, I don't know whether it's the baby boomer population, but I've seen, and I don't know whether it's, if it's something hereditary or genetically or scientifically or researched that population is more prone to have it. But on a day-to-day basis with me working, I've only experienced 2 females, and the rest were black males. And for me, I don't know whether, I can't say, now I will say this, some of the behaviors that some of those persons displayed in their younger years were parallel. So I don't know whether it could be their past drug use. I don't know. It's just me seeing what I see. But I do see that there is a large population of, I would say, baby boomers, age range, that suffer with Hep C, but a lot of them live healthy lives. I mean, they don't drink anymore, or they don't, whatever the thing was for them, they really live healthy lives.
Absolutely. And I agree with you on some of those points as well. So hepatitis C is different than HIV. Some people confuse the two, but those are two completely separate disorders. And hepatitis, by definition, is an infection of the liver. And there's different types of hepatitis. So hepatitis A is limited. That's more of like a simple stomach flu, kind of a food poisoning, and it goes away. Hepatitis B is a very common type of infection that's spread through IV drug use and sexual behaviors. And hepatitis C is also spread through the same ways, IV drug use and sexual behaviors. It's also spread through blood transfusions before they used to do testing. And the reason it's called hepatitis C is because it's linked with liver cancer. So that's different than some of the other types of hepatitis. But the hepatitis C is a unique category because it's one of the few viruses that we have actually discovered that causes cancer. And so now there's a tremendous amount of research and testing, just as you mentioned, in that population. So people who are, let's say, 45 years old up to 75 years old, currently they're not using drugs, they're not having multiple partners and so on. But in their teenage years, back in the 70s and 80s, definitely that was kind of the profile. That's what people used to do. And that's when really the epidemic epidemic started. And so now, if you watch on television or online, there's commercials about hepatitis C, not just the testing and the disease, but the treatment. And we're not at a cure yet, but some of the new treatments are actually allowing people to put it in remission. And what that means is they can live to be 85 or 90 years old, and they won't die of hepatitis. They'll die of other disorders like heart disease and diabetes, but those people are actually, like you said, able to live productive lives, but they never know they have it because they never thought about getting tested. And so that's a good point, where if you don't test, you're not going to find out. And with all of the media coverage and so on, I think it's wise that almost everyone get tested at least once a year for HIV and hepatitis, and that way you know what you have, and then you can manage it going forward.
Absolutely. And I don't know if it's because of, racial, economic, social, I don't know what it is, but I know that there are certain populations of people who just, whether it's they don't know the services or the services aren't available in their communities. I can't say it's one particular thing. It's a multitude of those things. But for whatever one of those reasons, they're not going to get their resources, or they're not getting the resource access to them. And that's a failure for all of us. I mean, because ultimately it costs all of us. It makes you have to work harder in an ER when you have a person who could have gotten free tested but didn't know, and here they are 2 years later, and like you say, they're suffering from so many other ailments. That costs us more. And again, I don't like to talk numbers, but if we can do this if we can lessen the impact on the front end, it's a win-win for us all, both again in lives and in the dollars. So it's really, really important that we go and we get tested. I don't know whether people are embarrassed, but it's nothing to be embarrassed about because, like you say, people are able to live productive lives. I see it every day.
Absolutely. Very good. And if you're just joining us on the show today, I have a special guest, Tawanna Jackson. She's the CEO and organizer of recoverywarriors.org. Her telephone number is 678-558-9330. She's able to connect a lot of individuals with mental health resources. Today we're discussing some of the infectious disease problems that are epidemic in certain communities, including HIV and hepatitis. And we had talked a little bit off air, and you mentioned some of the other illnesses that are also infection related. You mentioned specifically the homeless population. What other types of diseases or, infections have you been seeing a lot of in that particular population?
Well, in that particular population, I've seen a lot of, and I don't know whether it's a disease, maybe you can help me here, but they have a lot of scabies. There are a lot of skin disorders. There are a lot of digestive or ingestion type of diseases, whether it's gastrology. I don't know whether it's for them not having proper food. So there are a lot of internal type issues with their organs that are going on with the homeless population. I don't know if those are really considered infectious diseases, but those are some of the top health issues besides mental health that we see on a day-to-day basis with the homeless population.
Definitely.
It's lack of care.
Mm-hmm.
It's lack of care.
Sure. And I agree with you on that. And scabies, for those of you who don't know, scabies is also called bed bugs. It's more of like a parasite. It's actually related to head lice. So head lice would affect the hair, but scabies affects the skin. And so people who develop scabies, it's very contagious. It can spread in families. It can spread when people go to a college dorm or even if they stay in a hotel. But in the homeless population, they're sharing clothes, they're sharing, bedding and so on. And so the scabies will go from one person to the next. What happens is the scabies or the bed bug, it actually bites the skin and it lays eggs underneath the skin. And the itching that people have is so intense. Yeah. They scratch so hard, they bleed, and so they get open sores. And that's highly contagious, again, to other people that are around them. And so the scabies, unless you treat it with special prescription medication, it never goes away. And so those people, I will see them definitely in the ER because they're itching and they're bleeding in multiple areas. And we put them on the treatment. It's a special shampoo and a cream, and it goes away. But unfortunately, where they're going to is back to a shelter, or they're going back to, under a bridge, or they're still wearing the same clothing, and so they oftentimes relapse. And so I agree with you. Scabies, even though it's not life-threatening, it is psychologically and physically very, very disabling.
Yes, I mean, I never, until I started working direct, I never knew, because I guess we take for granted just our day-to-day lives and how, great we have it or what have you. And when I encountered having to do individual sessions with several peers that, had this, I mean, it almost looks like a physical dysfunction, because